Welcome to VU Academy. So today let's learn about appendicitis. What is appendicitis? Appendicitis is the inflammation of the appendix, which is a small pouch that is attached to the large intestine, and it's a medical emergency that often requires the surgical removal of the appendix. So let's see what's the anatomy of the appendix. Appendix is a small tube-like structure attached to the cecum, which is the first part of the large intestine. So, the appendix is located in the right lower quadrant of the abdomen. Here is abdomen has the 9 quadrants, and this is the right upper quadrant, and this is the right lower quadrant. So, this appendix is situated in the right lower quadrant of the abdomen near to the McBurney point. So what do you mean by the McBurney point? It is situated in 1/3 of the distance from the anterior superior iliac spine to the navel. So let's see what are the causes of the appendicitis. So, the causes are the blockage in the appendix, bacterial infections, and abdominal trauma. The blockage in appendixes occur mostly due to the stools, infections, or due to any other obstructions. Now let's study about the pathophysiology of the appendicitis. They are the obstruction of the lumen, increasing of the mucosal secretion and bacterial overgrowth. After that, it will cause the inflammation and ischemia. Then it will lead to the necrosis and the perforation. In this slide, let's study about what are the stages of the appendicitis. They are the early stage or the catarrhal stage. Then second one is the suppurative or the phlegmonous stage. Third one is the gangrenous stage. And fourth is the perforated or the ruptured stage. Fifth one, finally, it is the abscess formation or complicated stage. In this slide, from this picture, you all can see this is about the healthy tissues of the appendix, and this is about the appendicitis progression with the several stages. So, in the catarrhal stage, the appendicitis progresses through several stages, as we already said. So, in here, appendix become inflamed due to the obstruction, leading to mucus buildup and bacterial growth. So, it will cause mild abdominal pain, nausea, loss of appetite, and mild fever during this catarrhal age. Then it will develop into the phlegmonous or the suppurative stage. In this stage, it causes the inflammation, worsening, due to the pus collection inside the appendix. So as a result of that, it causes the fever, nausea, and vomiting. At this stage, the pain starts to shift to the lower quadrant of the abdomen. The third stage is the gangrenous stage. In the gangrenous stage, what happens? It causes the lack of the blood supply and causes the tissue death or the necrosis. And the appendix wall become more weakened. So, the patient feels severe continuous abdominal pain with high fever. And this shows the final stage. It means the appendix starts to perforate, and it will even cause the death of the patient. So let's see what are the common symptoms of the appendicitis. It will cause the sudden pain in the right lower abdomen, loss of the appetite, nausea and vomiting, fever and chills, constipation or diarrhea, abdominal bloating. So from this picture, you all can see the symptoms are very clearly. Then Let's study about the diagnosis of the appendicitis. The appendicitis can be diagnosed from the physical exams and from the blood test as well as from the imagings. Let's move on to the treatment of the appendicitis. If appendicitis is not treated promptly or emergency promptly, it will cause the rupture of the appendix, or else medical treatment is an emergency case. Therefore, we are going for the surgical removal of the appendix. So that procedure is called as the appendectomy. Now, you all can see, you all can understood about what happens in the appendicitis. Thank you for watching. Please subscribe my channel. Bye bye.